August is National Immunization Month, which is a great reminder for people of all ages to stay up to date to prevent serious illnesses. Mercedes spoke with Dr. Girisha Kaur from Southwest Medical, part of Optum, the sponsors of this segment, about the importance of keeping your immunizations current.
August is National Immunization Awareness Month, and we are talking vaccinations. Dr. Kaur from Southwest Medical, part of Optum, is joining me. Dr. Kaur, why is it so important for adults to get vaccinated?
Well, that's a really good question. And as you mentioned, August is the National Immunization Awareness Month. It's a great time to remind everybody how important vaccinations are because, not only do they prevent certain diseases from occurring, they reduce the risk for hospitalization or serious illnesses that can get somebody hospitalized. And of course, studies have shown that they help prevent unnecessary deaths.
And as we age, we are at risk for different kinds of diseases, right?
Yeah, absolutely. In our older population, there are higher risk for things like pneumonia, the flu. So, flu season's just around the corner. So that's definitely an important vaccination that's recommended really for all ages. But we really emphasize the focus on our, pediatric population and of course our 65 and above population as well.
What are some of the other recommended vaccinations?
Yes, so COVID is definitely still a recommendation. The flu vaccine, as I mentioned, for pneumonia, depending on, a person's risk factors and their age, certain pneumonia vaccinations need to be done. Tetanus boosters, we get tetanus when we're young, but then, there's also a booster that needs to happen every 10 years, so that's super important. More recently, there's an RSV vaccine, which is now recommended for adults as well to help reduce the risk for the viral infection.
I know my mother recently also got a shingles vaccine. Is that something you highly recommend?
Shingles is super important. If somebody has had shingles or had chickenpox, right? They're at risk for getting shingles. And even if somebody got shingles, they can get it again. So what's important to remember about the shingles vaccine, that doesn't necessarily prevent somebody from getting shingles, but if they were to get it, the impact wouldn't be as painful if they didn't have the vaccination.
And of course, some of these will be recommended by your doctor. That's why it's so important to talk to them based on your history, your medical conditions. What are other factors that you really take into account when it comes to recommending certain vaccinations?
So, age is the important factor. When was the last time somebody had a certain vaccination, whether there's a booster available for the vaccination, what is their job environment, whether they work in a healthcare facility or a non-clinical setting, or if they travel frequently. So it really does depend on the situation. So it's so important to talk to, your medical provider about what immunizations are right for you.
And our thanks to Southwest Medical for sponsoring this segment. You can get more information by calling that number, 702-877-5199, or visit smalv.com. We'll be right back.